Dr. Esma, today we're diving straight into the hidden side of dental implants, the part people whisper about but never really explain. And honestly, I'm buzzing because what we're about to reveal might completely flip someone's expectation. Before we even get into the big surprises, let me ask you this. Why do so many people say, "No one told me this," after they finally get their implant?
Rasim, that's exactly the point. They only hear the shiny success stories. But the real journey has tiny details that change everything. And when people skip those details, they walk in half blind. What's fun today is that we get to pull back that curtain gently and maybe surprise even the confident listeners waiting on the edge.
Exactly, and I want everyone to stay close, because there's one specific moment, you'll know when we get there, that could change how they approach their entire treatment plan. Let's warm them up first, Dr. Esma. What's the first tiny truth that opens the whole story up? Dr. Esma, I keep hearing people say the same thing. I thought getting an implant was just one quick step, and then reality taps them on the shoulder with a whole checklist they never expected. It's wild how many don't realize there's a timeline, a healing rhythm, and tiny decisions that stack up. Why does this catch so many off guard?
Razim, because most people imagine the clinic as a magic switch. Walk in, walk out, done. But real life looks different. There are moments like discovering a bone gap or learning that healing isn't a straight line. And these aren't scary, they're just human. When they understand these little twists early, everything feels calmer.
So basically, the problem isn't the implant, it's the surprise factor. And when people aren't surprised, they make smarter choices, feel safer, and stop imagining the worst. I love that. Let's break down the most common scenario people misread. Dr. Esma, this is where things get real. People think the hidden truth is something dramatic, but often it's something simple, like how a tiny healing delay can change the whole plan. And when they're not prepared, they panic. Can you give us an example that shows why these details matter?
Of course, Razim. Imagine someone who has waited months for their implant day, but during the exam we discover their bone hasn't strengthened enough yet. That's not failure, it's biology doing its job slower. When they knew this could happen, they're calm. When they didn't, it feels like a crisis.
Exactly. The stress comes from surprises, not the treatment. And when people hear real examples like that, suddenly everything clicks. They realize the process isn't unpredictable, it just has chapters. And knowing the chapters makes the whole journey feel like something they can handle with confidence. Dr. Esma, here's something people don't realize. Dental implants have one of the highest long-term success rates in modern dentistry. Yet the stories people remember are usually the rare complications. And that fear overshadows the facts. Can we give them a tiny, real-world case that shows the bigger picture?
Absolutely, Rasim. I had a patient who came in convinced something would go wrong because a friend scared them with a dramatic story. But their own situation was straightforward. Clean bone structure, healthy gums, good habits. They were shocked when they learned that most cases look like theirs, not the horror stories I'd heard.
That's the twist people don't expect. The average implant journey is often calmer and more predictable than the stories floating around. Knowing that gives them a huge sense of relief before they even take the first step. Dr. Esma, here's something people love hearing from you, the science behind why implants actually work. Because when people understand the biology, the fear drops instantly. Can you break down the real expert angle in a way that makes everyone go, "Oh, that makes sense now"?
Gladly, Razim. Implants succeed because the body recognizes titanium as friendly, not foreign. This triggers a process called integration, where bone cells grow around the implant like tiny anchors. It's predictable, repeatable, and incredibly stable. That's why experts trust this method even in complex cases.
So the secret is that it isn't magic, it's biology doing something incredibly smart. And when people learn that, suddenly the whole implant idea feels less like a mystery and more like a well-engineered partnership between science and the body. Dr. Esma, people love clear steps. When the path feels organized, the fear melts away. So let's give them a simple step-by-step roadmap, the kind that makes the whole implant journey feel doable from the first check to the final smile. What's the smartest order to think about?
Razim, it all starts with evaluation. First, a thorough scan to see bone levels. Next, planning, choosing the right implant size and position. Then comes the placement itself, which is usually quick. After that, a healing period where bone and implant form their bond. And finally, the crown that completes the smile.
That's the clarity people crave, a sequence that turns a big unknown into a structured journey. And once they see it laid out like this, the worry fades and the confidence kicks in instantly. Dr. Esma, every good roadmap needs guardrails. The little do this, don't do that, tips that keep the journey smooth. And honestly, people love these because they feel like insider knowledge. What are the key cautions everyone should remember before and after their implant?
Razim, the biggest, though, is follow the plan. Healing depends on consistency. That means proper hygiene, keeping follow-up visits, and avoiding pressure on the area until it's ready. The biggest don't is skipping steps or self-diagnosing. When people try shortcuts, they risk slowing everything down.
So the rule is simple. Trust the process and don't improvise. Those tiny choices make a massive difference, and knowing these cautions turns potential stress into smooth sailing. Dr. Esma, let's dive into the fun part, the myths. People hear the wildest things about implants, from "it's super painful" to "it always fails," and these rumors stick harder than facts. What's the most common mistake or myth you wish everyone would unlearn today?
Rasim, the biggest myth is that implants are unbearably painful. Modern techniques make the procedure surprisingly comfortable. Another mistake is assuming every case is identical. People compare their journey to a friend's without realizing their bone, gum health, and healing speed are totally unique. When expectations are realistic, the whole experience becomes smoother.
So the truth is simple. Most fears come from myths, not reality. And once people sort the facts from the noise, they see implants for what they really are. A reliable, science-backed solution. Dr. Esma, now let's give people something they can screenshot. A quick win checklist. When someone knows the small actions that boost their implant success, they feel instantly more in control. What should be on their must-do list?
Rasim, here's the simple but powerful list. Keep your mouth clean with gentle brushing. Follow the dietary guidance during healing. Attend every follow-up and stay consistent with hygiene. Add one more thing. Ask questions whenever unsure. These tiny habits create a smoother experience from start to finish.
Perfect, quick, doable, and confidence boosting. And when people treat these steps like a daily ritual, they set themselves up for a predictable, stress-free implant journey. Dr. Esma, nothing hits harder than a real story. People remember a journey far more than a lecture. So give us one, a short, powerful case that shows how someone went from uncertainty to confidence. Something that makes viewers think, okay, that could be me.
Rasim, I remember a patient who walked in worried because they believed implants were unpredictable. After a full scan, we discovered everything lined up beautifully. Strong bone, clean tissue, perfect conditions. Their relief was instant. Weeks later, during the final check, they couldn't stop smiling at how smooth the journey felt.
And that's the twist. Most success stories feel surprisingly calm. When people see a real-life example like this, they realize the path isn't scary at all. It's structured, scientific, and deeply reassuring. Dr. Esma, let's look ahead for a moment. People love knowing where the world is going, especially in something as life-changing as implants. So if we fast forward a few years, what's the big shift coming? The trend that'll make viewers say, wow, I didn't know it would get that advanced.
Rasim, the future is incredibly exciting. We're moving toward fully personalized implants, designed shaped perfectly to each patient using advanced 3D modeling. Healing times may shrink thanks to new surface technologies that encourage faster bonding. And even AI-driven planning will predict ideal angles with remarkable accuracy.
So the big prediction is simple. Implants won't just restore smiles. They'll become smarter, faster, and even more personalized. And knowing that makes the whole future of dental care feel incredibly promising. Dr. Esma, we've covered the hidden truths, the science, the myths, the roadmap, everything people wish someone told them earlier. Now, let's wrap this up with a clear takeaway. What's the one message viewers should walk away with before making their big decision? Oh,
Rasim, it's this. Implants aren't mysterious or frightening when you understand the steps. With proper planning, honest expectations, and a trusted expert guiding you, the journey is predictable and empowering. Anyone considering an implant should start by asking questions and getting a personalized evaluation.
and if you learned something today, hit follow and stay tuned because we're just getting started. Your future smile deserves clarity, confidence, and the right guidance.